Welcome back, everyone. The questions still coming in about COVID-19 and the state response. We continue our live conversation with Dr. Benjamin Chan via Skype to answer your questions. So, Dr. Chan, Mary asks, what are some of the less common symptoms of COVID-19?
Oh, great question. So you hear a lot about common symptoms being fever, cough, and shortness of breath. Many people don't present right away with these symptoms. A lot of times symptoms begin with mild flu-like illness. That can be extreme fatigue, muscle aches, headaches. But one of the symptoms that we're seeing also develop are people losing their sense of taste and smell, which is a little bit unusual for these types of viral infections. And I think we're still understanding why exactly that is. But this is something not just noticed in New Hampshire, but also in other parts that are experiencing COVID-19.
Yeah, very interesting. Nicole wants to know, why are we not allowing the development of herd immunity in response to this virus like we have with other pandemics?
Yeah, anytime we attempt to control a pandemic virus like this, there are many considerations. First and foremost is protecting people and protecting lives, right? Preventing severe outcomes, trying to prevent hospitalizations and overwhelming our healthcare system. We are trying to control and suppress this outbreak right now so that we can decrease the number of hospitalizations, decrease people dying from this infection. But one of the later complications that we will have to address is that there are potentially a large number of people that are out there that have not developed immunity. And so when we go to open things back up, so to speak, our communities may still be at risk for experiencing additional outbreaks because of the lack of exposure and protection that communities have. That's something we're going to be monitoring very closely, and we'll work to open up communities safely when we're past the peak of the outbreak.
Sam has two related questions. The first, are the persons being monitored on the DHHS website the traced contacts of diagnosed patients?
Yeah, so we are monitoring, our public health team here is monitoring a number of different people. People that are diagnosed with COVID-19, we reach out to and are in contact with them. And we also have been reaching out to people who are, for example, close household contacts, high levels of exposure, to monitor, help monitor them for symptoms. So we're monitoring both infected people who are on isolation and close contacts who are also on quarantine.
Sam's second question, how is DHHS tallying recovered cases? Are these previously diagnosed patients that are retested, or are they just marking new cases from 2 weeks ago as now recovered?
Yeah, another excellent question. And as I just mentioned, we're checking in with people when they've been diagnosed with COVID-19, and when they're able to come off isolation, we're marking them as recovered. What are the criteria for someone coming off isolation, whether they are a suspect, have suspect COVID-19 or actual lab confirmed COVID-19? It's the 7-day, 72-hour rule that we talk about, where someone needs to be at least 7 days out from the onset of their symptoms, and they need to be at least 72 hours fever-free with improving symptoms. They need to meet both of those criteria, then they can come off isolation and we mark them as recovered.
Deb wants to know, can you elaborate on the underlying conditions of the persons who have succumbed to this virus?
Yeah, so we announced today that there are a total of, unfortunately and sadly, 21 people who have died from COVID-19 in the state so far. And that's exactly what we're trying to prevent with our public health and community measures to stop the spread of this virus. All of those individuals, the vast majority of those individuals, were over the age of 60 or had, in fact, everybody was either over the age of 60 or had some type of chronic health condition, which made them more vulnerable to this type of unfortunate outcome from COVID-19.
Our hearts certainly go out to those families. Thank you, Dr. Chan. We will be right back after a quick break with more questions.